Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to another episode of the Lunch and Learn with Dr. Barry. I'm your host, Dr. Barry Pierre, your favorite board-certified internist, founder of drbarrypr.com, as well as PR Medical Consulting, helping you empower yourself for better health with the #1 podcast for patient advocacy. And this week, we bring you a special one. We have Dr. Angela Fadahunsi, who is a allergy and immunology specialist who's going to be schooling us and educating the Lunch and Learn community on allergies, on sinuses, what are some common things we can use to kind of treat our allergies, and how a lot of us may be using a very common product wrong. I know at least I was. Before we get on with the show, I want to talk a little bit about her so you can kind of know exactly how credible this person is. Because again, I think with the Lunch and Learn community, I want to bring, specialized guests who know what they're talking about. And, this one's no different. She earned her medical degree from the University of Texas. She completed her internal medicine residency as well as her specialty in allergy and immunology fellowship at the University of Tennessee Health Science Center in Memphis. Dr. Angela combines knowledge with compassion, and she is proud to offer allergy and asthma relief for her patients. She knows firsthand how it feels to have allergies to keep you up from enjoying the beautiful world around you. And as a result, has become an empathetic doctor who always takes time to listen to your needs. And of course, for a lot of my allergy sufferers, especially in the Lunch and Learn community, this is actually a topic that we've been really wanting to get on the show for a while. This is a very common reason why patients walk into the hospital. It's the very reason why patients walk into the doctor's office. Is actually one of the more requested topics from the Lunch and Learn community that I wanted to get on. And I didn't feel like I would do it as much justice if I didn't have someone specialized to come and talk and school us a little bit about our allergies and our sinus problems and what we can actually do about it. So, sit back like always. If you have not had a chance, make sure you subscribe to the podcast. Make sure you leave me a 5-star review. Leave Dr. Angela a 5-star review. Let Dr. Angela know how well she's doing. And you guys have a great and blessed day. This episode is brought to you by the Lunch and Learn community store, where we are living out the motto, empower yourself for better health. In the Lunch and Learn community store, you can get your favorite t-shirts, ebooks, as well as other related products by Dr. Barry. Head over to shop.drprsblog.com and get a chance to get 10% off your first purchase by using the coupon code EMPOWER10. Again, shop.drprsblog.com. Live out the motto, empower yourself for better health. All right, Lunch and Learn community, you just heard another great introduction from a guest who, honestly, I've actually been kind of looking for. For those who know, who've been following the Lunch and Learn community, I've been looking for an allergist for quite some time, just to kind of talk about, allergies and sinuses and, everything, whatnot. And of course, like I've said before, I know a little bit about a lot, but I always, whenever I can, try to get an expert on to kind of talk and educate us here. And, that's what I have today, right? So again, Dr. Angela, thank you for coming on to the show.
Thank you.
So, okay, first of all, I gotta, again, we heard the introduction, we heard the bio. But for those who, again, this may be the first time they're hearing about you, can you give them a little introduction on who you are and, how you got to where you're at today?
Absolutely. So thanks again for having me. I'm Dr. Angela Fadahunsi, as you mentioned in your introduction. Originally from Louisiana, grew up in a town called Lake Charles. And then after graduating from high school, went to college at Xavier University of Louisiana, which is in New Orleans, medical school in Galveston, Texas at UTMB. And then all of my postgraduate training in medicine was at University of Tennessee. So internal medicine residency for 3 years, and then allergy fellowship for 2 years. And now just recently opened my allergy practice here in the Dallas, Texas area, northern suburb called Wylie, Texas.
And we're definitely going to talk about that, especially I love, not only do we love, being able to educate the Lunch and Learn community, but I love physician entrepreneurs who kind of step out, and especially in this day and age where, owning your own stuff isn't really, championed or really encouraged. And I can say this, I'm a program director for internal medicine residents. And I could say that, a lot of times I think graduate medical education doesn't prepare us enough for it. So I definitely want to talk a little bit about that towards the end of the show as well. Just like the thoughts of like owning your own business, which is very, very impressive to me. So I'm an internist, and you're an internist as well, but you also went and got subspecialized in allergy and immunology. Like, tell us what drew you to that field during your residency?
Yeah, so I honestly, allergy is such a small field when you think of a lot of the other subspecialties, and so it's not very well known. I wasn't aware that the field even existed until I was in college. And so that at that point, I was already pre-med, knew that I wanted to be a physician, wasn't sure exactly which route I was going to go once I got into medical school and then, residency thereafter. But it was pretty much a personal experience. The primary care doctor that I was seeing referred me to an allergist during my college years. And I was like, oh, this is pretty cool. I'd been suffering with allergies all of my life, as long as I can remember from childhood, and just never had a name for what it was. Just thought that was just, sinuses as we call it, but didn't realize that there were things that you could actually do about it, ways to investigate it. And so when I started seeing an allergist and then subsequently being treated, realized, wow, this is awesome. What capabilities we have available as allergists can be really life-changing as far as the quality of life day to day for people and the symptoms that they suffer with. So that's what drew me to it, learning about it through personal experience, and then also really seeing the benefits of the care of an allergy specialist.
No, that's very interesting, because I always wonder, like, was it like where did you have a lot of allergies kind of growing up, and then especially as what I find when I was taking care of patients outpatient, they come to me, they'd have some issues, upper respiratory infection, come back, have some, and they would just keep coming back and forth. And then finally, I had to say, like, hey, I think you need, I don't think this is just a regular infection, because you shouldn't be having this over and over again. Like, do you tend to find yourself getting a lot of those types of patients where, they've been through the ringer, they've had the antibiotics, they've seen the urgent care, and nothing kind of seems to help them?
Yes. I mean, that's most of what I see when it comes to what we call allergic rhinitis, or, hay fever, seasonal allergies, whatever label we want to give it. It's people that have been dealing with these symptoms for years and really are kind of at their wits' end of like, okay, what is going on and what can be done about it? For me, the first time I remember an experience of, now identifying that I was allergic was in elementary school. We had a field trip to our state capital in Baton Rouge, and there's this really pretty hill that comes that rolls down the front of the state capital. And we were in maybe first or second grade, I can't recall. And everybody thought, oh, it'll be fun to roll down the hill together. So we did, and I got up itching, sneezing, watery eyes, redness, all of that stuff. And again, never understood exactly what that was and why the other kids didn't feel the way that I did. And then same thing, just, seasonal allergies all the time, every year. It was always the same thing for me. And so, yeah, most of the people that I see have similar stories where they've been suffering for a long time and just are kind of, stuck and don't know what else to do and where to turn.
It's very interesting. I was definitely the same way where, I wasn't a kid who played in grass. I wasn't a kid who liked to, because I would get short of breath. I'd get a lot of welts and all of these things. I was like the kid, like I wanted to be clean the whole time.
Yeah. Yeah. And that's how kids are. They don't have a name for it, but they know that it doesn't make them feel good. And so they just naturally start to avoid, and adults too, naturally start to avoid the things that are triggers, because even though they don't really understand that it's necessarily a trigger, I know when I play in grass or when I'm running around outside, I don't feel well. So I'm just not going to do that. So yeah, that's where we come in, and we can, do our best to try to get to the root of what's going on and provide answers about how to deal with it.
So for the lunch learn community, they love to hear numbers, right? Because a lot of times I don't think they can grasp like how serious, every disorder, every disease we tend to talk about is on this podcast, right? So I want to just give you some numbers, Lunch Learn community, just so you can understand how important that we really should be thinking about allergies. And we'll talk to Dr. Angela as far as like, because I feel as a subspecialist, a lot of times they get cases maybe a little later than they should. That's always my personal thought. I never know. So from an allergy standpoint, right? Allergies are the 6th leading cause of chronic illness in the United States. They cost about $18 billion a year, and more than 50 million Americans suffer from allergies every year, right? Just so you guys can get an idea of like how important her field is to just health and just wellness in general. It's very interesting. I was almost shocked by those numbers. Like, wow, I didn't.
It's very, very prevalent, very common. Absolutely.
Now, are you, especially in your field, like, is there some allergies that you find are the worst than others, that are more common than others, like as you're practicing?
As far as more common, I'll start with that first. So certainly, springtime and fall seem to be the seasons that people in general suffer more. At least in my experience, those seasons tend to be more common as far as, people complaining of symptoms.
Mm-hmm.
So fall, being ragweed, spring being tree pollens, which is, a multitude of different types of tree pollens, grass pollens, et cetera, during those seasons. Jumping back to one particular or a certain group being worse than others, it's a really subjective answer for that, because everybody's different, of course, and so some people it's just a little bit of over-the-counter Zyrtec or Claritin or whatever does the trick and they're fine. But some people another person could have the exact same allergies or sensitivities and they're miserable. They've got asthma related to it as well. And so their symptoms are now being, the triggers rather are now exacerbating their chronic asthma issues. So there's not necessarily one particular thing that's worse. It's really just about the quality of life that particular person has, when dealing with whatever their particular allergies are.
Okay. Now, so we're gonna get personal, right? Because in Lunch Learn community, I'm gonna talk about myself a little bit because I need to talk about sinuses, right? And I'll give you my little backstory. I'm from South Florida. Mm-hmm. And I went to school in Tallahassee, which is North Florida. When I was in South Florida, I didn't have any issues. I was fine. No watery eyes, no stuffy nose, nothing. When I went to school at Florida State, all of a sudden, summertime, springtime comes around. I would just be watery eyes, tearing up uncontrollably. It had nothing to do with nothing. Stuffy nose. I was absolutely I don't know what it was up there. In Tallahassee, in that area that caused all these problems. But I got to know, what are we doing for sinuses? Let's talk about sinuses in general, because I'm biased, right? I feel like it's an epidemic, right? It's going everywhere.
Yeah.
I have friends who follow me on Twitter, and we're literally every Monday, we'll say hey, how you doing? How's your sinuses? Did you make the weekend? That's usually a running joke with us, because it's just something we don't look forward to.
Yeah. So, of course, over-the-counter treatments is where everybody starts, and that's what we recommend as well. So Zyrtec, Claritin, Allegra, whatever your preference is. I usually encourage people to not do Benadryl just because of the sedating effect of it. And it usually is not as long-lasting, whereas the other ones you can take once or twice a day and, be covered as far as your symptoms are concerned. From there, if that's still not giving you resolution of your symptoms or, improving, your symptoms, then the next step is your nose sprays. And nobody really likes the nose sprays.
No one I try to get my patients to do that.
Yeah. But, it actually works better than the allergy pills or, antihistamines do. It's going to cover more as far as the symptoms that you're experiencing, especially the congestion that a lot of people suffer from. The allergy pills themselves, or antihistamines rather, don't have any effect on that. They're mainly for the sneezing and, a little bit of what we call the rhinorrhea, so the runny nose. But when you're thinking of the congestion, that's where your nose spray comes in. And what I find with a lot of people is they're not using it correctly. And so they also for that reason are not getting the benefit of it. And you've got to use it for at least 2 to 4 weeks consistently to really get the optimal benefits. So there's a couple of things that go into play as far as getting, what you can or the best relief from the nose spray. So I always make sure that I educate people when I'm starting them on a nose spray or when I'm seeing them for the first time about the proper administration techniques so that they're getting what getting what you paid for, basically, not kind of wasting your money and wasting your time by doing it. Now, once you've done those two things, if you're still not having, benefit or relief, then that's the point where you need to see a specialist, whether it's your primary care doctor, discussing with them what your options are. And then from there, they can determine, okay, well, let's go ahead and send you to an allergist, or coming straight to an allergy specialist is, of course, an option as well. So that is the gist of sort of where we start. And then, the other thing too is with what we offer as far as medications, we're just treating the symptoms, right? We're not dealing with the root cause. And that's where the allergy specialist can come in as far as identifying what exactly is it that you are sensitive to that's causing you to have the watery, itchy eyes, the sneezing, the runny nose, the congestion, post-nasal drip, whatever your symptoms are, and finding those triggers and then educating you about what your options are to deal specifically with those triggers instead of just medicating the symptoms.
No, I know, especially from the trigger standpoint, like I tend to think when I'm educating my patients, like I always think about the trees, which is such a bland term, because what does that even really mean?
Yeah.
Right. Like I say, the trees and pets, like those are always my two biggest things. But are there other common triggers that you've seen that some people tend to neglect?
Those are pretty common ones. Another one that, especially for people that suffer year round. So, there's certainly people that are just springtime, just fall time, just summer, whatever the season may be. But then there are people that have triggers or symptoms year round. And one thing that we always consider, of course, is pets. Do you have a dog? Do you have a cat? Are you exposed to a dog or cat on a regular basis? And is that causing your symptoms? But then dust mite is another common, what we call perennial or year-round allergy. And that kind of varies depending on where you are in the United States. But in general, if there's I shouldn't say any amount of humidity, but a decent amount of humidity, then you're going to be exposed to dust mites. And where dust mites accumulate the most as far as our exposure levels on a day-to-day basis is in our bedding. So your pillow and your mattress. And so when we can identify dust mite as a trigger or a sensitivity or allergy for a particular patient, then we can counsel them on ways that they can minimize that exposure. And that's where you get your, dust mite proof covers for your pillow, your mattress and bedding, washing your sheets once a week in hot water, your linens in hot water to try to minimize that risk or exposure rather on a day-to-day basis. So that's one that doesn't always come up, but is very prevalent. And then, like you said, you nailed it right on the head with, the trees, of course, being a big one for people that have spring allergies. And like I mentioned before, fall, ragweed is pretty common in a lot of places in the United States as well.
I know here in South Florida, we tend to deal with not necessarily trees, but more like an environmental issue because they burn sugar cane during times of the year, and we see a lot of the quote unquote allergy. Which again, I think allergies is such a basket term. I think a lot of people call everything allergies. So I never really know if it's allergies. I never really know, but the burning of sugar cane tends to cause a lot of these quote unquote flare ups of allergies and some environmental issues as well.
Yeah, so it could certainly be, but then also, of course, when you've got smoke exposure or just things in the environment, chemical substances or things of that nature. Irritation as well can cause similar symptoms. So, but hard to say for sure, but yeah, definitely a consideration.
No, especially, yeah, what I was interested in, because I know we talk about allergy immunology, but like asthma is, especially in your practice, is a big, I guess component of it. Like how much in relation to just allergies in general, like does asthma play a role, or is that more from the immunology standpoint from your training?
No, so it's all linked together. So people that have allergies are at risk for development of asthma. There's actually something that we call the atopic march with children. So kids, can start off with eczema. So, the dry, itchy skin, irritated skin, and then that can progress to allergic rhinitis. So all of the nasal symptoms that we were just discussing. And then from there, it can progress to asthma. So the respiratory issues, the coughing, wheezing, shortness of breath. And the link between all of that is whenever you have asthma, especially if you do have an allergic component or allergic asthma, as we call it, knowing your triggers is very important because it's going to help you identify, and your allergist or your primary care doctor identify what seasons to be extra mindful of, keeping a close eye on you. If you've got a ton of tree allergies, then when springtime comes, before springtime comes, I need to make sure that you're good and you're well controlled, because we know that those tree pollens are coming, and those triggers, those allergens on top of your asthma history puts you at risk for what we call exacerbation. So worsening of your asthma symptoms, or, poor control of your asthma symptoms, leading to hospitalizations, urgent care visits, ER visits, steroid burst. So yeah, definitely a huge link, especially in the pediatric side, but also in the adult side as well. It's very, very common for the two to kind of go hand in hand a lot of times.
Now, because I definitely want to delve into just, your business, quote unquote.
Mm-hmm.
Now, I know you talked initially about how a lot of people are using the nasal inhalers wrong. Like, how do you use that wrong?
Yeah, so the proper way to use your nose, so your Flonase, Nasacort, Nasonex, that's what I'm referring to when I say nasal sprays, is to, when you stick the nozzle in, or the tip into your nose, you actually want to angle your head down. So I always tell people nose to toes. So have your head down a little bit. And then when you stick that nozzle in, or that tip, you should angle it towards the outer corner of your eye. So angle it out on both sides whenever you administer it. And what I notice is a lot of people don't, of course, do that because they've never been told, and that's understandable. It's really kind of strange that, at least the ones that I've seen, I've never seen the instructions written on any information that I goes home with the patient. So it's understandable that people don't know that. So that's the first part of it, making sure that you're angling it towards the outer corner of your eye, top of your ear, on either side. The other thing is, a lot of people do take a big deep sniff in or inhale in. Don't do that. When you do that, what you'll do a lot of times is have that medication go right into the back of your throat. And a lot of the complaint that people have is, well, I don't like the way it tastes, or, you're not really supposed to taste it. It's supposed to stay in your nose. So when you feel it going down the back of your throat, then you've probably inhaled too deeply, or, just basically sucked it down into your throat, and it's not really penetrating and getting to the tissue that is swollen and causing you the problems as far as the allergy symptoms that you're experiencing. So those are the two biggest things: pointing it towards the outer corner of your eye, and then just take a natural inhale in. You don't have to do anything extra as far as getting that medication where it's supposed to go.
Lunch learning to me, I just want to let y'all know, I am 0 for 2 on use, because I don't know why I thought for sure it had to point in towards. Yes. Okay. All right. Yeah. So we all learn here, lunch learning community. We're all learning. That's funny. Okay. So let's talk about your practice, right? Let's talk about, why you want to start your practice. What was some of your motivations behind it? And then eventually what we need to let people know how they can come see you.
Yeah. So for me, I was really fortunate with my allergy immunology training experience. We had the opportunity, of course, it's an academic institution, so we train, with lots of great experts on the academic side. But then we also had the opportunity to work with private practice allergists who were out in the community and affiliated with our university. So I had the chance firsthand to see the best of both worlds, the pros and the cons of staying in academic or being in an employed position, as well as the pros and cons of doing it on your own. And being in private practice appealed to me, but then also what I felt the allergists who were owning their own practices, what they really appreciated about it, drew me as well. And so that led me to decide, okay, you know what, not only am I going to do private practice, but I'm going to open my own practice and do it on my own. And what I hope for with my practice is that I create an environment and an experience that people don't necessarily see in other practices or other medical offices. And I can kind of steer the ship the direction that I want it to go without having to do a lot of, I don't want to say negotiating, but, when you're the leader of whatever situation, when things aren't going the way that you want them to go or the way that you feel is in the best interest of your patients, it's up to you, and it is ultimately your decision to change the direction of things. And I just wanted to have more control over what I was able to provide for my patients and always feel like there wasn't anything hindering those decisions. And that's the reason that I decided to do it for myself, to kind of start afresh and build something that I could be really, really proud of and be a part of for the long run.
I love it. So as an internist, are you only seeing, like, again, I tell people all the time, if you're 17 and below, I don't even want to, are you only, because it definitely feels like there's a lot of overlap, but do you only see adults and up? Is there like a cutoff for you?
No, I see children as well. So allergy is one of those unique fields where we cross-train to see both adult and pediatric patients. So actually, me coming from the internal medicine side, it's a requirement. And, same for my co-fellow who was coming from the pediatric side. It's a requirement that at least, I think the percentage was at least 60% of your patient population be from the other side, So for me,
okay.
As an internist or internal medicine physician, it was required for me that at least 60% of my patients be pediatric to meet, the standards of ACGME for my allergy fellowship. And so a lot of what I saw was pediatric, but then I also had the chance, of course, to see lots of adult patients. So I feel very comfortable seeing both. And even down to like age 4 months or so, we would see patients, especially with the newer recommendations for early introduction of peanut for kids that are at risk for development of peanut allergy. And eczema, of course, is a big thing for infants as well. So all ages come into my practice, pretty much birth to old age.
Oh, wow, that's nice.
Yeah.
That's nice. Like I said, if you're 16, 17, I get weary. So
yeah,
you see it on younger. That's great. Is that question, especially in your practice, is there like common things that, issues that people kind of deal with on a day-to-day basis, but they don't even realize that they're actually dealing with an allergy problem?
I think a lot of what we talked about is that, like you were mentioning, you have patients that come in and they've always got, bronchitis or quote unquote sinus or sinus issues or, whatever, terms people like to call it. And a lot of times that is just plain and simple what we call allergic rhinitis. There's an allergy trigger to it. And if we can identify that, then we can, give you answers and work on getting you feeling better and getting you feeling well. So that's the most common thing. And then, of course, sometimes it isn't allergies. It may be something else, but certainly making sure that that's crossed off when you've got somebody coming in with the same seasonal complaint year after year after year is definitely warranted.
Okay. Now, when should And speaking as an internist, when should I be sending my patients to see an allergist? And if you're just a patient out there who's even dealing with these issues, like when should they be coming to see you?
I usually tell people when over the counter stuff is not working well enough for you. So, and that's again a subjective thing. If it's bothersome to you, and what you're doing isn't helping, then that's when you need to see an allergist. Like I mentioned, for some people, taking Claritins or Tech or whatever over the counter is fine. And they're like, okay, I'm good. Whatever. I can roll through spring, with a Zyrtec a day and I'm okay. Whereas other people, it's like, no, I'm miserable. My head is always hurting, or, I'm always sneezing. I can't get my work done. That's another thing too. It affects quality of life, but it also affects people's productivity at school and at work whenever they aren't feeling well for whatever reason. But certainly if you're having to blow your nose every 10 seconds and, you can't breathe out of your nose well, or your eyes are always watering. I mean, just imagine dealing with that for a season at a time or constantly on and off all year. How productive will you want to be when you're feeling that way? So once over the counter isn't working, then that's when I suggest people see a specialist to get to the root of what's going on and try to get answers about what they can do.
All right. Again, doctors, I want to thank you for, really helping enlighten, especially me, but definitely the lecturer community on allergy, because it's a topic, like I said, it's been so requested that I said, okay, I gotta find one, and I found you. I was like, ooh, like I gotta make sure I jump at a chance. Before we let you go, the question I like to ask is like, how can what you do empower others to really take better control of their health?
Yeah, so I think anytime we can have answers about what's going on with our bodies, that's the start of taking control. It's hard to take control when we don't really know what's going on, or what can be done about it. So anytime that I can give answers to people, it's such a relief for me to be able to provide that answer. But it's also, of course, a huge relief for other people when they can point to, this is the reason why I don't feel well. So I think that's the gist of it. It empowers people because they now have an answer. And then once you have an answer, you can work towards a solution. So yeah, it's all about just trying to provide answers and give people the knowledge that they need so that they can have that quality of life, the productivity, and just be able to enjoy the everyday things that we want to enjoy, going outside, taking a walk, breathing fresh air and not feeling miserable, minutes later.
I love it. So where can someone find you? Where can someone find you? Whether it's social media, whether your physical office, like where? Because
my office is in Wylie, Texas. It's a suburb of the Dallas Metroplex, so northeast Dallas suburb. And as far as online, you can reach me online through either of my social media pages, Facebook or Instagram. On Instagram, it's at Allergy Wylie, so all one word, and Wylie being spelled Wylie. And then on Facebook, it's Allergy and Asthma Care of Wylie. So either of those places, send me a message. There's also an email, of course, on my website, www.allergywylie.com, and you can communicate with me that way as well.
Perfect. And again, if you're driving, at work, wherever you're doing it, all her links will be in the show notes as well. So you can, get directly in contact her and get your allergies right. She just wants to get you outside for the summer, right?
Right. Enjoy some fresh air. Take a walk. Stay healthy.
Again, thank you so much for joining the podcast. Like, this has been absolutely amazing, and I already know we're gonna have people jumping for joy, being able to kind of learn, especially that nose thing. Like I said, I'm 0 for 2, y'all, so we need to be 2 for 2 after this episode, everybody.
Thank you for having me.
Thank you for getting to the end of the show. I am your host, Dr. Barry Pierre, host of the Lunch Learn with Dr. Barry, and this is another amazing episode that we like to bring to you week after week on betterment of empowering yourself for better health today. If you have not had a chance, please go ahead and subscribe to the show if this is your first time listening. If you already listen and you've already subscribed, make sure to leave me a 5-star review because your support is absolutely important in keeping the show moving as it is. And if you have not had a chance and you want to check out today's show notes, always head over to lunchlearnpod.com. That is lunchlearnpod, all in one word, .com, and you can get the access to my show notes for every single episode, but especially the one you just listened to. And I'm going to see you guys next week. You guys be blessed. Bye.